Call upon the next presenter, Ravindra Patel, to present on the topic, Cloud Computing in Healthcare Industry.
So hello everyone. My name is Ravindra Patel, and I'm a full-time student at Campbellsville University, and this is the research part of my education research project. As I'm conducting during the research is topic is cloud computing in healthcare. So let's begin with introduction to the cloud computing, which is this project contains the necessity of cloud computing in the healthcare industry, such as introduction, planning, and that needs to be faced, benefits, challenges, methodology, and so on. So let's talk about the basic, which is cloud computing is a term as an infrastructure of application-based software, which is generally store the data over the remote servers. Uh, the data can be like accessed from anywhere using the internet, along with the deliveries ample computing such as a server, databases, networking, software analytics, storage, as well as intelligence on the internet. Overall, it offers a flexible resource, it fosters innovation and economic upscale. Using a healthcare, which is a cloud computing in the healthcare, offer a flexible solution that allows the hospitals and healthcare professional to support a network based on remotely accessible servers. As in hospital, there is a need of storing a huge amount of data and the files. So cloud computing is perfect for storing a large volume of files and data securely, which is maintained by the IT professional. Let's move to the next slide. Okay, so here's the healthcare and cloud computing. So which is on using a cloud computing services, there is a no need for maintaining a patient's data physically using a pen and paper. Instead, all records are being stored in the cloud, which ensure the security and it's easily accessible remotely from anywhere. All the records can be maintained or modified online. Moreover, paperless records are possible through it. All the records then transaction would be seamless and virtually, so no unauthorized person can access the file and authorized user would have access to them. So let's do, okay, so now we talk about the planning with the cloud computing, which is the user must be always cautious while maintaining the file online to avoid duplication and misuse of resources. So using cloud computing must conform to the act of the HIPAA, which is name is like full from is a Health Insurance Portability and Accountability Act. The service ensure federal law to prevent leakage of patient sensitive as well as personal information. So issue in a cloud computing basically is one use physical copy to maintain a records. Then there are certain issues that are needed to be faced, such as information may get misplaced from one to other places, more time consuming on sifting and hard copy documents. The most possible issue would be on mixing up all the documents together or with the rest of the others. All right, so now we talk about the benefits of cloud computing. So benefit means it's allow the storage of sample data of patients with easy, including his or her past medical history records, and along with those files would be the safe that no others can get through it. On requiring the data, the user can easily retrieve it with the zero loss. Um, Along with that, cause of the disease can be easily figured out and the patient health status can be easily analyzed. Okay, and continue with the benefits. There's a patient guardian or the hospital administrator can upload the patient prescription to the mail ID pharmacy, resulting in the less waiting time for the patients to receive the medicines. Along with that, patient can avail of the discount or cashback in a wallet, which can be later redeemed on the next purchases. This helps cost cutting for the prescribed medicines with the hassle-free payment process. And if there is a conjunction in the server for which is problematic to place an order, one of the easily place the order over the phone. The most perfect utilization over the online, that is, a patient can be easily examined by the doctor over the internet, through it's not that effective. So the patient can be still advised by the doctor to the remotely. Let's talk about the challenges. So the cloud computing is facing challenges, which is one of the most important part for the maintaining cloud computing for the healthcare industry is privacy as well as the security. So this is well checked. Along with that, misuse of information leakage by bypassing it or by selling the data outside. Let's continue with the more challenges of, which is like there is always a prominent diagnosis of disease with 24/7 life supporting machines. The worker of healthcare are able to learn new technologies over the course of times. This relieves the patients with satisfaction that he or she like being treated correctly with no blunders. Let's move to the methodology. So methodology basically is across worldwide, there is a vast usage of artificial intelligence as well as the machines that can diagnose the patient disease along with the remedy and required medicine. So moreover, AI and other machines have learned the mixture of two or more composition of medicine accurately, which is not exactly possible by human to do. So there are certain algorithms required to make this machine execute programs that are required and provide distinct reports. So it has proven huge positive impact on medical sectors. Here is the healthcare parameters. So which is reproductive outcomes, identification of death causes for increasing life, determining the quality of life, data related to like one condition, clinical metrics with the socioeconomics, environmental, living standards are included here. The information that like one suffering regarding the health consists with these sections. So let's do that. Okay, here is the cons and pros for the cloud storage. So let's do the cons. Like the data storage capacity is a higher compared to the another storage facility. It's uninterrupted service according to the needs and requirements. Collaboration with the clients regarding their information becomes easy. AI and machine learning facility can be a reason behind this mismatch. Cybersecurity issue also are there. Security breaches on patients, personal information redirect to the personal risk. There are benefits of using cloud services such as unlimited data storage. Also, like service will be scalable according to the user's need. Files can be easily shareable between the clients. Using the cloud networks, consumption of time can be minimized as well as with efficiency implementation must be done on switching from manual to cloud storage as it is entirely a new method of handling the task. Improper handling of data may lead to a leakage or misuse it of. So like HIPAA compliances, which include certain security measurements and which extend protocol for privacy related to the patients of their guardians. So here is the cloud authentication, which is required for the storage. Like we can do like push notification should be turned on, SMS token code should be enabled, OTP of like a one-time password should be like opt-in. Also, we can do like secure the ID with a strong combination of numeral alphabets as well as with the special characters. All these methods ensure the user secure the storage from malware and various virus attacks. Entering password to unlock is quite common nowadays. So scanning with the fingerprints along with it makes it more secure than before. So if anyone logs into the one account, then it can easily be traced, including the location and IP address. So here's the protection of data cloud. So like protection likewise, always use a cloud system that has the ability of encryptions, going through the user terms and condition with certain agreements. Applying a strong combination of password that consists of numerals and special characters. Uh, Along with that, uh, that we can do like a two-factor authentications. It's very vital to make the profile secure from fraud and unauthorized access. Sharing personal information without knowing the input mode lead to misuse of ones. An antivirus is quite the essential part of the resolving the issue, and getting third party do not have the access on a one private information. What one does is opt in for the after steps of a form. So the user must be like aware of the reading edge and every word of line truly before signing or proceeding through them. So privacy setting must be reconfigured every month to avoid leakage of personal credentials. Password must be always contain a mixture of alphabets, numerals, and special characters. If anybody tries to get access to a PC, someone's cloud storage, then it's advisable to check in a two-factor authentications. So it helps user to get stranger, so like IP address and location. So personal information is always sensitive, so more one keeps is a secret, the more benefits one is opposed to achieve. So installing a genuine version of malware software or antivirus that can be assessed unwanted files to enter into the system and corrupt into the personal data. Here is the use of the data sets. So basically data sets it's a detailed year wise and location wise healthcare information of patients. So doctor information and their specialties, types of patients and their specific disease, availability of medicines and other equipment needed for treatment. So basically, generally like this is a data, the data is released to a person, past medical records, which is include symptoms, procedures, diagnosis, and outcomes. So special information or suggestions are being provided by the doctors. So this data is always used to go through the stock of medicines and other required equipment for treatments. So now we talk about the conclusion. So in conclude, with every now new days, the technology always like also improve hugely. It is giving the society a new face, which is involving innovations. The user must utilize to a best and for good purpose. So nowadays, almost all sectors such as banking, offices, shops, etc., have been like made by computerized, mostly computerized. So do the hospital is also no longer manually operated. So by doing so, there are noticeably fewer blunders. So continue with the conclusion. So there is a no doubt that the technology or the online methodology is being applied all over the hospital sectors, but it shouldn't pause over here. So more research should be carried out to improve the healthcare departments. So along with that development of technology, it's ensure technical backup function better than hospital staffs and employee. The government should show interest and assist with the working with besides scientists and medical experts to modify more upgraded machines to save more people lives. Training should be more extensive for the healthcare units, resulting in minimizing any errors for the worker and staffs. So, clear. This is like clear of my doubts and regardings like about facts and all queries related to the clouds computing. So, AL and artificial intelligence, its contribution in healthcare units, its a benefits and advantages, uses of method and implementation, and so on. So here's the references, and this is a part all I'm completing with my presentations. If you guys have any questions, feel free to ask.
Thank you so much, Mr. Ravindra. So we are enabling the poll for Mr. Ravindra. The participants can start voting. Participants, if you have any queries, you can raise it in the QA session or in the chat box so that Mr. Ravindra would answer. We have one question for you, Mr. Ravindra. In healthcare settings with poor internet connectivity, how is cloud computing application?
So basically, like cloud computing application is like is a server base. So I can say like if it's that application is already in the system. So the server are running through the internet, but if application is already in the system, so you don't need that internet as long as you want to share data or any like you do the communication over the internet. So you can easily access the whole system as long as it's existing to the system. So you can able to access all data and everything, except if you want to do any transaction over the internet.
Thank you so much. We have one more question for you. Given the present challenge with electricity, especially in the African context, how can we effectively use this technology in Africa?
Particularly, I can say it's depends on situation and scenario, but I know the Africa is also like lack of like the technologies the worldwide now is more growing, but I'm not sure about the how condition is there, but uh, more likely I can say like it's worldwide cloud computing is growing because it's a more is into the healthcare and a lot of healthcare facilities which is using it. So I'm not exactly sure about that, how they are implementing over there. So
thank you. We have one more question. What are the mechanisms put in place for villages that lacks internet connectivity?
I know there is a lot of places which is less internet connectivities. So in that case, we usually follow like old style, but nowadays like system is upgrading and so basically we can connect with the internal system through the if it's source of internet is available, that would be great. But if it's not, then we can connect through the some other way, which is we can have like cloud computing softwares. So we can pre-install in the computers and then you can access to the system. So that way also you can able to access.
Thank you so much. We have one more question from Grace. How expensive is this model? And don't you think the data records will need more training?
Yeah, so I can say like expensive wise, this is it's a little quite expensive, but for organization, if you wanna install that, it's more convenient because they provide more security and more benefit for the patients, so they can easily accessible over the internet any place wherever they go. So I can say like it's more convenient for everyone, like because nowadays like cloud computing is broadly spread, and this is the easiest way to do it because the doctor and patients like easily they can communicate each other, even they can see in person. So I believe this is the easiest way, like we can use the cloud computing.
Thank you so much for the wonderful presentation, Ravindra.
Thank you everyone, thank you so much.